So hair transplantation and women, it can be a difficult area. The simple answer is yes, women can get surgery, but you have to be very careful in terms of how you proceed with that. It often takes a lot longer before a woman will go for surgery, because one of the things that can happen is something called shock loss. Shock loss is something that doesn't happen with everyone, but it's more likely to happen in women than men. And what you'll see is that the normal hair that hasn't been transplanted surrounding the site where either the hair has been taken from or moved to, it has a reaction in that it falls out. Now, luckily the hair grows back over time, but understandably that's a very upsetting thing that you see happen. If you're looking to have an increase in hair density, and for the immediate period after surgery you're looking at a reduction in density. One of the things that's come along over the years that has allowed us to conduct surgery in women and get a better chance of not seeing shock loss is the use of minoxidil, which is a medication present in either you put it on as Regaine or Rogaine, or more recently you take it as a tablet. And that has seen a dramatic reduction in the number of women who get shock loss. So as a result of that, we tend to be a little bit more hesitant when it comes to surgery. It certainly offers a wonderful treatment option, particularly for women who've got focal hair loss, but it's something that you have to take time to get to.